Well, good night, everyone. Sorry for that difficulties that we were having. Good night. Thank you for being here again in one of my webinars. I want to thank Brightbot.com for sponsoring them. I would like to remind you that your microphones will be muted throughout the presentation. And at the end, I'm going to give some time so you can ask me some questions, which is my favorite part and the most important. Also, if you're not watching this live or if you have any questions that you can ask at the end of the webinar, you can go into brightbot.com and record a video question, and I will give you an answer for that, or somebody else that knows the answer. So let's begin. Well, I would like to remind you also that this comes from my medical experience, but of course does not replace a medical consultation. Today, we're going to be talking about kidney disease. It's one of my favorite topics. For those of you who are new, my name is Jaime Meza. I'm a medical doctor. I work mainly on the ER, but also with some chronic conditions. So I always like to start by talking about some numbers with every condition about kidney disease. We can say that the prevalence of this condition is about 14%. We're talking about the United States. So that means 14% of the population has some kind of chronic kidney disease. The main causes for this in the United States are high blood pressure and diabetes. Almost half or more of people with chronic kidney disease have diabetes, so it's #1 risk factor. More than 600,000 Americans have kidney failure, and of course, a very big number of these populations are gonna need dialysis in the future, so almost 500,000. And it's very important because these conditions kill more than the most common cancers, which for men would be prostate and for women breast cancer. So this actually kills more people than that, so it's very, very important. This time I wanted to do something different, because I really think the kidney is amazing. So in these numbers that I want to talk about, I would like to say something about the kidneys. First of all, for you to know, maybe you're not really sure or you don't know the size of the kidney, but it's something between about 4 inches by 2 by 1. So it's fairly small. It can fit in your palm, but it filtrates blood, something between 37 to 50 gallons of blood every day, which is amazing, taking into account that it's very, very small. And what's more amazing is that one kidney by itself can do the job. That's the reason why people can donate one kidney and still live a normal life. So that's something which I think is amazing, and I wanted to share with you. But now let's get into the topic. What is chronic kidney disease? Of course, there are many, many different conditions, but basically any condition that leads to a decrease on the filtration of blood by the kidney in a period of time. So of course, there's acute and chronic. Acute is something that develops new, that is present for a short period of time, and then it corrects itself. Chronic is when this happens and basically the damage stays there forever, for the rest of your life. We classify chronic kidney disease in different stages depending on how bad is the filtration capacity. So it's not really important for you to know, but obviously stage 1 is the best one, almost no damage, and stage 5, people who need dialysis and probably kidney transplants. So what happens if your kidney is not working properly? That's, I guess, the question that basically tells us about the symptoms of chronic kidney disease. Basically, we have to understand that the kidneys have different functions. They balance the amount of liquid of water that's present in the body. They also regulate the electrolytes and the filtration of toxins, either by releasing more of these toxins to the urine or keeping. I know it sounds weird when I say keep some toxins and not releasing them, but of course we can mention here some medications, some drugs that might be considered toxins, but of course for us doctors, we use it as therapeutical. So of course, the kidney, sometimes we have to play with that in order to know the effect that a medication is going to take, is going to do. And the third thing the kidney does, it's regulate and produce certain hormones. So if we understand these three functions of the kidney, then we start knowing what symptoms kidney damage or kidney disease will cause. Of course, when we talk about liquid balance, basically you can either show dehydration or fluid retention, which is actually more common. So obviously, and I showed this last webinar, but of course you start seeing edema, which is the swelling of different parts of the body. It's more common in the feet, like I said before in the past webinar. It's because gravity basically takes that liquid to the feet. And if you put your finger there for a while, you can see that that print will still be there. This also happens in the lower eyelid, and it's usually some swelling that happens in the morning, and that as the day goes by, it gets better. When we talk about the filtration of electrolytes and toxins, then if the kidney is not working properly, those will accumulate in the body, producing arrhythmias that can lead to cardiac arrest or confusion, because these toxins, of course, go to the brain and prevents it from doing the functions properly. And with hormones, of course, we can see that the blood pressure starts to rise, both because you are retaining some fluids and also because the hormones that regulate the blood pressure are controlled by, well, in a certain way, by the kidneys. Also, vitamin D and a hormone that is called erythropoietin, it's produced in the kidneys, which basically, when it's not working properly, might lead to osteoporosis or to anemia, because the EPO, the last hormone I talked about, gives the signal to the blood, to the bone marrow to start producing red blood cells. So if it's not working properly, of course, that's what's going to happen. You're going to have anemia. What causes kidney disease? Well, there are several factors, but as I said before, high blood pressure and diabetes are number one. Actually, it would be the opposite. Diabetes is number one risk factor, and then high blood pressure. The mechanisms by which this damage is produced are a little complex, but of course we have to remember that both are cardiovascular conditions, so they affect the blood vessels. And the kidney has very, very, very high blood flow. It needs gallons and gallons, as I said before. So when the blood vessels are affected and narrowed, of course that flow decreases, and then the whole function of the kidney is affected. There's some other conditions like glomerulonephritis, which is basically the inflammation of the smaller parts of the kidney, which can be produced by infections, autoimmune conditions, and many other causes. One of these, and the most common, would be lupus, which is an autoimmune condition. Some obstruction, like for example, when you have kidney stones, that might also lead to kidney disease. And of course, well, this picture that is pyelonephritis, which is the infection of the kidney. So several, maybe not one, but repeated infections might lead eventually to kidney disease, failure, I would say. So who's at risk of developing these conditions? Of course, obvious, the same two, people with high blood pressure and diabetics. There's an increased risk for African American and Asian American population. They more than any other population, they are at an increased risk. Of course, people that smoke, I've already talked about this, and cigarette or tobacco use, but mainly cigarette because it contains more chemicals. They also damage the blood vessels, so of course this is going to lead to the same thing. Certain malformations of the urinary system or of the urinary tract. This is just a picture that shows that basically the urine, it's returning, it has a reflux, but there are different malformations of the urinary system that might lead, of course, to kidney damage and age. As we age, it is expected that our filtration rate, the amount of blood we filter and the amount of urine we produce, we expect that it will decrease with age, but of course, it shouldn't decrease to the point of a kidney failure. But anyways, we know that with age, the risk increases also, of course, because it also increases the risk to have high blood pressure, diabetes, and some other conditions. How do we diagnose chronic kidney disease or kidney disease? Basically, of course, the physical exam is the main. I mean, because we have to suspect. We might see some of the liquid retention that you're having, or some certain pain, or or your blood pressure might be high. So we start to suspect this. Of course, the way we measure how the kidney is working is that we try to measure some substances that are supposed to be filtered by the kidney. So if they're getting accumulated in the blood, then we know the kidney is not working properly. One of those substances is called the creatinine. So that's one of the ways we do it, and it's on the basic metabolic panel, which it's a very very regular test that we do. That's the way we do it. We can also look at urine, which at first might seem like the best choice, but not necessarily. It's better to do it in the blood for the renal function. But then there are certain things that we might see in the urine, for example, proteins. In the normal kidney, most proteins are not supposed to be filtered because their size is very big. But when you start having kidney failure, then those proteins start to flow freely through the kidney, and you start seeing them in the urine. So of course, having proteins in the urine is definitely a sign of kidney conditions. That's the reason why we have to do this at least once a year for patients that have diabetes and high blood pressure. We do require a urine test. So maybe you were wondering why your doctor did it, no matter you're a man or a woman. Maybe he was trying to look for proteins in the urine, which is an early sign of kidney disease. Ultrasounds, basically, they are good for many conditions of the kidneys. We can see kidney stones. We can see certain inflammation in certain infectious diseases. We can also see the size. Of course, when the kidney starts to not functioning well, the size starts to decrease, and the relation between the center and the cortex begins to change. So that's something we do also. We can look at the whole urinary tract by basically injecting a dye to see if there's any obstruction. That's also something we could do also. And of course, we have the same MRIs and CT scans, which are also very useful. How do we treat these conditions? I guess it depends what's the reason, but we have some treatments for the symptoms, but obviously we have to also treat, and the most important thing would be to treat the underlying cause of this disease. For symptoms, well, we have water pills. Basically, as I was saying, one of the most common symptoms is to get your feet swollen. So water pills will help you with that, but they will not necessarily help the kidney. They're most symptomatic, as I was saying. Of course, when the kidney function is almost zero, then we have to start dialysis. Here in this picture, I'm only showing one type of dialysis. There are two. This is the one that I'm not showing is the peritoneal dialysis, which is another process in which basically the blood is filtered by the peritoneum, which is a layer in your inner abdomen. But basically, the idea is that dialysis helps filtrate certain toxins and the same thing. So it replaces, in a certain way, some of the functions of the kidney. But of course, this is not something that will replace it forever. And this creates certain other symptoms to the patients. And this is actually an experience that is very, very difficult to, well, to live. Now, obviously, we treat diabetes. We can treat it with metformin. We can treat it with insulin. We can treat the high blood pressure, and those are treatments that I've mentioned before. But of course, the important thing is that you have to remember that it is better to treat the underlying cause. So we have to always have two different treatments, one for the symptoms and one for the underlying cause. And at the end, definitely the last resource is the transplant. So basically, we get a new kidney. It can be from a living person, as I mentioned before, and basically you have now 3 kidneys. This basically cures the condition, but again, if the underlying cause is still there, then your new kidney is still at danger, and of course the other one that's left. So I have a couple of questions that are very common and I would like to answer. So one of them is my back hurts. Is this a sign of kidney disease? This is very, very common. I get it almost every day. The answer is that usually the kidney disease does not produce any pain. Most nerve terminals are located in the capsule that surrounds the kidney. And this capsule only releases the pain signals when it's stretched. So basically, when the kidney is swollen, when the kidney starts losing function, actually it starts shrinking, so it wouldn't produce any pain. There are certain exceptions to this, and those exceptions are in the pyelonephritis, which is the infection of the kidney, because in this case it will get swollen and it will stretch the capsule and it will cause certain pain that might resemble a back pain. And also with kidney stones. With kidney stones, there are other types of pain. They can irradiate to some other places, but it might also be in the back. So in these cases, yes, the answer would be yes. In the rest, it's a no. So if you have a back pain, the probabilities of this being from your kidney are very low. There are some probabilities, but usually it's more somewhere else, muscular maybe. This is another question that I get a lot. Is drinking beer good for your kidneys? Well, the answer is that not really. Basically, any type of alcohol in moderate quantities forces water to be excreted. So basically, it forces the kidney to produce urine. Not only beer, wine, any type of alcohol, which might be beneficial to the kidney, some kidney conditions, because obviously as water flows, for example, with kidney stones, the urinary tract will be kept clean. So in this condition, it might seem that it's good, but of course, we can do the same by just increasing the amount of water we're taking. It doesn't have to be with beer or any other type of alcohol. And we also have to take into account that the chronic consumption of alcohol is related to multiple other conditions, liver diseases, pancreatitis, mental disorders, gastritis, and many, many others. So of course, the risk of developing other conditions outweigh the benefits. So I wouldn't recommend it as a treatment, of course. And what about drugs? This is something that everybody is asking. When we prescribe something, the first thing that people ask is this damaging my kidney, or will it damage? And I've read posts in Facebook that says, do not take this drug, omeprazole, or any other drugs because they are damaging your kidney. Well, the answer is, of course, that some drugs have a toxic effect on kidneys. That's the reality. Not all of the drugs, but some. But of course, this toxicity is dependent on the time we use the drug and the dose that we are taking. So of course, when your doctor prescribes you a medication, he has already considered that the benefits, of course, are that you're gonna get are greatly, I mean, they're superior to the risk that you're gonna be exposed to. So of course, it is safe to take these medications as indicated by your doctor. There are some over-the-counter medications like non-steroidal anti-inflammatories, which are naproxen, ibuprofen, meloxicam, and of the same family, that may lead to chronic kidney disease. And of course, caution is advised when you're taking these medications. And you see, the problem with the medications is that when we prescribe them, we can control more the amount, the dosage, and the time that people and how people are using it. But with over-the-counter medications, we're not able to do so. So the big problems happen with those medications. So of course, try to mention to your doctor every time you're with him or with her this over-the-counter medications that you're taking, so we can assess the risk and advise you or change the medication maybe, so you're not gonna have chronic kidney disease, because this is now a rising problem. And last but not least, there are certain medications that actually offer certain protection against kidney disease, not for chronic taking, but for certain procedures. For example, when you're gonna get certain imaging of your body and we need to use a contrast dye, this might damage the kidney. So it will be normal for your doctor to prescribe you some medications before, bicarbonate or some, even IV fluids themselves are medications, and they protect the kidney. So this is a more complete answer to this question. So I hope you liked the presentation, and I hope some of the questions you also had, and maybe they were answered. But now I'm going to listen to your questions, which I like. So thank you for your attention.
Dr. Mesa.
Yes.
So if you have diabetes, you're definitely going to end up with kidney disease?
No, not, well, it depends on how controlled your diabetes is. If by the treatment that you're having, either only pills or only exercise or insulin, it depends on every patient. But if that treatment actually has your diabetes under control, you don't have to get chronic kidney disease. The problem with this is that since diabetes is very silent, it's one of the conditions in which we have a big problem trying to make our patients understand that even when they're not feeling anything, this is still affecting their bodies. So unfortunately, there's a big, well, not a big, but a percentage, and any percentage is bad, of people that realize that the diabetes is bad because we start detecting that their kidneys are not working properly. So of course, for those patients, it's a little late. We can still control a little bit, but they already have damage. So the ideal thing is that if you have diabetes, you work hard to control it so you don't have to suffer from the consequences. And you don't have to if you take good care of that.
Okay, thank you. I have another question.
Yeah, go ahead.
I've heard that if you are diabetic, you should probably just go ahead and start using insulin than doing the metformin or the other drugs that are out there. What's your take on that?
Well, uh, definitely, I wouldn't say that's true. It depends. Every diabetic is very, very different. And as I was telling you, people that are, some people are or start taking their treatments when their diabetes is already pretty bad because either they didn't know or they were kind of in denial because that's something very common. But if you start treating the diabetes on time, it was discovered early, maybe you can control. There's people that control it just with diet. That's how diabetes is, and it can be controlled just with medications. I've had patients with diabetes for 20, 30 years that are only taking pills, and they never have to use insulin. Of course, since this is a genetic condition or has a genetic burden, some people simply get a more aggressive type of diabetes, and even when they are taking care of the diet and exercising, they do require insulin. So I guess it is something that it's different each patient. But most patients, if they take care of themselves and they take the pills how they're supposed to, they're not going to need insulin. So it's not that insulin is the best and you should take it right away. You can wait and you can try some things as long as you are getting frequently checked by your doctor and the treatment is being followed by your doctor. Then he is the one with you, of course, that will decide when it's time to start insulin if you have to.
Okay, thank you.
You're welcome.
Yeah. Yes, Dr. Mesa. I want to follow up on that question because folks do say that the metformin hampers the kidneys and that it's better to do the insulin.
Yeah. Well, definitely metformin for certain patients might be nephrotoxic, which means that it might be toxic for your kidney. Not for every patient. Usually most patients can use metformin without ever presenting any problem. We have to be careful with the patients that have diabetes and they have already some kind of kidney disease already going on. For those patients, then metformin wouldn't be the best option. Metformin would be a very good option for the diabetic patient with a normal kidney function. Of course, if this patient starts developing certain kidney damage, we have to stop metformin. But that doesn't mean he has to go immediately to insulin. Maybe, nowadays there are many different available options of medications that are not toxic for the kidneys and that you can still try before going to insulin. So maybe, I guess this answers your question.
Okay. Thank you.
You're welcome.
Dr. Mesa,
Yes.
is there any way that are there indicators that you're not producing enough urine, on a regular basis, like every day? I mean, are there any markers or, should you be producing like a certain amount, going to the bathroom, is there anything that you should be aware of or observing?
Yeah.
That would indicate your kidneys are not working efficiently.
Well, yeah, definitely. For you, at least for you to notice, or for any patient to notice that the urine production is decreased, the damage has to be pretty bad for you to actually notice it, because the production of urine varies a lot from one patient to the other. Of course, certain patients produce somewhere between 1 liter to more than that a day, 1.2, 1.3. Some others produce 800 milliliters, something like that. We do have a number that we know it's an indicator of kidney damage, but it's very difficult for a patient to actually measure this because he or she would have to pee in a container and actually measure it. Of course, this would be measured by hour. That's another thing. So of course you have to collect urine for 24 hours straight and divide it by your weight and by some other variables. So we, as doctors, we do it. And of course, we mostly do it in hospitals when patients are already hospitalized, that it's easier for us to measure this. So there is a way, but it's a little complicated for a patient to do it. There are other indicators of kidney damage that, of course, patients will notice first. Like I was saying, number one, it's your feet. When they start getting swollen, and for example, your socks, they leave the mark of your socks, that's when you should start wondering, maybe I'm retaining some fluids. And the same with the face, that you wake up in the morning with a very puffy face, like your eyes are closed. And then as you start peeing, then your face starts getting rid of these liquids. That's also a very good indicator, more than simply the amount of urine you're having. Of course, this is important, but it will appear in a very late stage.
Okay, thank you.
You're welcome.
Is there any truth to the fact that once you're on dialysis, you're unable to urinate?
Definitely, yes. Of course, like I'm telling you, the one of the main functions of the kidney is to produce urine. So of course, when you are at stage 5 of chronic kidney disease, maybe that filtration is 0. So that means blood goes through the kidney, but nothing gets filtered, so there's no urine there. So there are actually patients that are in dialysis that they never pee anything. They don't produce a single drop of urine. That's true. Not every patient. Most patients have what we call a residual kidney function. That means they pee very little, some of them a little bit more, but there are some patients that actually don't produce any amount of urine. So it is true.
So what happens to the urethra that the pee comes through?
What happens? Well, basically, well, because I mean, there are certain glands in the body that produce some liquids that help lubricate the urethra. So it will probably stay patent. I mean, liquid can go through there, so it's not a big of a problem. But basically, what I can tell you is that no urine passes through the urethra. So basically, it stays dry all the time. But it can still, if that patient had a kidney transplant, he wouldn't have any problem urinating again.
Okay.
Okay.
Doctor, I have a question.
Yes.
To follow up on that last question about not having any kidney function whatsoever, so you have to basically expel your waste through dialysis. Would that type of a patient be advised to maybe restrict their fluid intake? Is that something that would normally happen, or no?
Yes. Definitely, if you're not producing urine and you're not being able to get rid of that extra fluid, then that drinking a lot of fluid will lead you to a very high blood pressure. So yes, we do recommend those patients to decrease the amount of water they're taking. Dialysis is a process that it affects each patient in a different way, because of course the kidney function is very different depending on the size, the race, everything of the patient. So when they go and get dialyzed, they lose all of that extra water in the body, so they lose weight, they sometimes get dehydrated. So we do advise patients to limit the amount of liquid, but we have to also start being careful, because after dialysis, this patient is going to feel very bad and might be dehydrated. So it depends on the patient, depends on the residual kidney function. But yes, of course, one of the strategies would be to reduce the liquid intake.
Okay. And one more question, sir.
Yes,
This doesn't really have to do with kidney disease, but it actually has to do with the kidneys. I'm gonna ask it.
go ahead.
I had an acquaintance, somebody who's a friend of a friend who passed away over the weekend.
Oh, I'm
And
sorry.
thank you. Not somebody I knew really well, but I knew who that was. And she had open heart surgery about a week ago, and they had administered some drugs to lower her blood pressure, to I guess to keep the site from rupturing where they did the repairs.
Yes.
And apparently the reduced blood pressure reduced the blood flow to her kidney, and her kidneys failed. Is that plausible? Yeah.
Yeah, definitely. For example, in kids, this is possible for both adults and kids, but the kidneys of the kids are more susceptible to damage than the adults, especially when we're talking about volume. So basically what we have to understand is that blood needs to flow to the kidney, so the kidney has something to filter. If there's nothing there to filter, then the kidney will start accumulating this, because it needs a certain pressure to do it. If the pressure is too low, then blood would go through, but the filtration process will not take place as effectively. So this is actually called pre-renal failure, because it is affecting the kidney, but it's before getting to the kidney, because we have pre-renal, renal, and actually post-renal, like obstructions. So it is plausible. That's the reason why in kids, we are always trying to see the hydration. That's why they have their special hydration salts, and that's why it's important, because they are more susceptible to dehydration. So they don't need medications to lower their blood pressure in order to have kidney failure. With just diarrhea or anything that can dehydrate a child might produce kidney failure. So I know this was a little bit more what you were asking, but definitely yes, the decrease in the blood pressure and blood flow does produce kidney failure. Yes.
Okay.
It's reversible. It's reversible.
Okay. Thank you.
You're welcome.
Dr. Mesa,
Yes.
let me ask you a question and following up on someone that has to take dialysis. If the fluid intake may be a detriment to them, what then do you do for them to have some sort of fuel or liquid in their bodies? Is it intravenously or something like that?
Not really. It doesn't matter how you take the liquid, if it's IV or it's orally or by any other way, it will still accumulate in the body. So of course, this is something that is actually very difficult to assess, and also it's a problem that's difficult to solve. I guess the doctors always have to be, and I'm sorry for this word, but like playing a little bit with the amount of blood that's going to be dialyzed each time, and how often do you need dialysis? Because of course, but in one hand, we have the problem that they need to get rid of this liquid, but in the other hand, we have that everybody needs water to live. So of course, basically what we try to do is limit the amount of liquid they have, but of course, they still need to take some, at least the minimal vital, and then if the patient is accumulating more liquid, then we start doing dialysis more often. There are people that need it only 3 times a day and their blood pressure is okay and they can live with that. There are people that need it every day of their lives, and there are people who just need it twice a week. So this is the way we try to manage these situations. But it doesn't matter do it IV or if you drink, it will still be the same.
Oh, okay, thank you.
You're welcome.
But Dr. Jaime, you can also get too, right? It's not necessarily just drinking like water or liquids. Don't you get some liquid from your food itself?
Yes, yes, but like I'm telling you, it will be exactly the same. Let's say that you are only eating watermelons, and that's how you get water. You will still have to limit the amount of water. Doesn't matter if it's liquid water or sodas or coffee or even the foods. We still have to find a way of counting the liquid inside of the food so you can regulate how much are you taking. Because anyways, it will all become water in your body and it will make some problems with the kidney.
Okay.
Why is it that people are under the misconception most of the time that a problem with their kidney would result in a back pain? What is the logic there? Especially since you say in most cases that's not true.
Well, I guess the misconception started because there are, like I mentioned, certain conditions that might resemble a back pain. The reason why is because the nerves that go to the kidney also go to certain muscles in the back and to the capsules of those muscles itself. So it's like a heart attack. When you're having a heart attack, not only your chest will hurt, but also your arm and your jaw. This is for the same reason. The nerves that go to your heart also go to those parts. So some nerves that go to the capsule of the kidney and of the urethra, they also go to somewhere in the back. So in the cases where the capsule is stretched, like I mentioned for kidney stones, for example, or pyelonephritis, then this is true. But then people hear that somebody had a kidney infection and they were having back pain, so they think every kidney disease will produce back pain, which is not true, like I mentioned. Maybe that's the explanation.
Okay, thanks.
Dr. Mason, I have a questions.
Yeah, go ahead.
I have glomerulonephritis since 2002, and I'm wondering if there's any new medications which is prevent this sickness or something like new. What I can do and treat my sickness, like what I can do it for myself.
Well, it's a very good question, but a question that is very hard to answer because glomerulonephritis can be produced by different conditions, and I guess I will have to know your condition. Why is it causing it? Of course, we know that not most, but some of these conditions might be caused because the body is actually attacking the kidney itself. I'm not really sure if this is your case. If that is the case, which is a very common cause, there are new medications that are being developed. Nowadays, what they call the biologicals, which are the medications that end up in like rituximab and all the animab, those medications are being developed to regulate the immune system to stop it from attacking the kidneys and producing some inflammation in the glomeruli, which might be the case, but of course, there are so many different conditions, infections, autoimmune diseases that I'm not able to answer your question 100% accurate. But of course, we are working in developing new medications, and hopefully one day we're going to be able to stop this disease from actually happening. Now, the reversing the damage that you have, that is also something that we have to work. But now, unfortunately, it's very difficult for us to tell you that it's very, very hard to reverse the damage caused by glomerulonephritis. It's reversible to a certain point if we stop the cause, but it will basically produce certain damage that is until a certain point irreversible. So like I'm telling you, I would have to know a little bit more about your case to give you a better answer.
Okay. And one more questions. Since I spoke with my GYN doctor, he said that I can become pregnant, but when it's happened, I was in really bad trouble. So who can decide it about it? The first, I need to ask the doctor, the kidney doctor, or GYN.
Well, like I'm telling you, I guess it depends a little bit on your whole story. But one thing is that you cannot get pregnant because it's physically impossible, like fertility problems, which I don't think is your case, is that you shouldn't, which probably is the reason. Because as you know, when women get pregnant, the blood flow and the blood pressure rises a little bit. So of course, if you are experiencing kidney damage and your kidney function is not 100%, then of course this might worsen throughout the pregnancy. So of course, if you go to your OBGYN, he will tell you that this is a decision that you will have to take by yourself. But of course, it's between the two doctors. It's not that one of them will be more important. One of them will take care of your pregnancy, but the other one will actually tell you, your nephrologist probably will tell you that this is not the best idea. Of course, the OBGYN will consult with him, and he'll have at least a stronger opinion and about how dangerous it is for you to get pregnant. So I guess his opinion, and it's difficult for me to say, but I guess it's more important now because he'll be able to determine what the probability of you actually, having an adverse reaction or not having a successful pregnancy. I guess the nephrologist will be more knowledgeable of this.
Thank you.
And I invite you, if you can and if you want, to record a little bit more about your story, like I said, in brightbud.com, so I can know a little bit more, and maybe I can answer that question if you want to do it. Oh, sorry, I couldn't listen what you said. I guess your microphone is muted. I'm not really sure what's going on. Nope.
Hello, now?
I can listen.
I said it's very interesting and it's very important for me, and I have like a million questions. It's always I have a problem with my back and pain, and I feel like my kidney is jumping sometimes, and sometimes I have a blood pressure, but it's not really high right now.
Yeah, of course, those are all issues that might be related to this. So that's my invitation. If you want to do it and you want to record some of those questions that you have, maybe by knowing a little bit more of your story, we can, me and other doctors can answer some of those questions that you have. Okay?
Okay.
Thank you.
Thank you.
Okay, well, thank you all for your attention, for your wonderful questions. As you can see, this is a subject that I really like. I hope you enjoyed it. And if you have further questions, please go into brightbud.com and record a video question, and I will make my best to give you a very good answer. So again, thank you and have a good night. And please come to the next webinar next Tuesday.